washing my hands. So, good morning, Mr. Brown. I'm Analia. I'll be your student nurse today, and I will be doing a focus assessment on a few different systems. But before we get started, I need to check your name and date of birth.
Okay. Logan Brown, 11/05/98.
Okay, sounds good. This will only take about 5 to 10 minutes, so not too long.
Okay.
But first, I am going to look at your chest. So if you would, just lift your shirt up for me.
Okay.
And I'm going to be looking for any signs of lesions or any signs of asymmetry with the chest. And I'm going to be checking for a barrel chest to make sure the patient is in good health. Okay, looks good. Inspiration and expiration looks good to me. Okay, so now I'm going to assess your lung sounds, and I'm going to listen to the burst
Okay.
with my diaphragm. Okay, I'm going to listen in the clavicle, so inspirate, breathe in and out. It's good. Breathe in and out. Okay. Breathe in again and out. And breathe in and out. Okay, so lift your shirt up for me. And everything sounds good so far. I don't hear any crackles or wheezing. So breathe in, out, in, out, in, and out. So now I'm going to assess your back. So on the front side, everything sounds good. Okay, so I'm going to listen up here. Breathe in and out. And breathe in. And out. Sounds good. Breathe in and out. And breathe in and out. Okay, so now I'm going to check underneath the scapula. So breathe in and out. And breathe in and out. Okay, so everything sounds good. I don't hear any crackles or wheezing overall. And so now I'm just going to palpate. Do you feel any tenderness? No tenderness. I don't feel any crepitus. So lift your shirt up for me. So no tenderness. Not feeling any? Any crepitus? Okay. Don't feel any. So your back too. Any tenderness? Don't feel any crepitus. Okay. Up here same?
I'm good.
No crepitus. Okay. So I'm gonna look at your skin. It's warm to touch. Temperature, it feels normal. I don't see any crackles or dryness on his skin. No venous distension. So that all looks to par. Okay. So now I'm gonna listen to your heart sounds. First, I'm going to listen in the second intercostal space on the patient's right side for the aortic valve. I'm going to listen with my diaphragm. Then the pulmonic, which is the second intercostal space on the patient's left side. And then Erb's point is going to be one down from that, which is the third intercostal space on the patient's left side. Let me get you, Cheetah, lift your shirt up. And I'm going to listen to moving forward. The tricuspid valve on the patient's left side, the fourth intercostal space. The mitral valve, which is the fifth intercostal space, the patient's left side. Okay, sounds good. And so the mitral and tricuspid would be an S1, which would sound like a lub, and the aortic and pulmonic would be an S2, which would be a dub. Okay, so I'm going to get you to lay on your left side for me. Okay, and now I'm going to listen for an S3 or an S4, and in these I'm going to be listening for murmurs, and an S4 would be heard before an S1, and an S3 would be heard after an S2. So I'm going to listen for any swishing or bruise, and I'm going to listen to it with my belt. Okay. So I don't hear any signs of abnormalities. So everything checks off for that. And I'm going to get you to turn over this way. And you can sit up. Good job. So now I am going to state your pulses. So we have our patient's brachial pulse. I'm going to assess it. Feels good. No bounding or weakness. Maybe a +2 or 2+. Then their radial pulse. Feels good. Then this is going to be their popliteal, and then the dorsalis pedis would be on the top of the patient's butt. So I would feel it on the top. I'm going to assess that. And then I'm going to assess the posterior tibial pulse. Okay, so that all feels good and checks off. All right, so now I'm going to state your central pulses, which would be your carotid, femoral, which are in here, and your apical, which I'm going to listen to with my diaphragm. So about 66 beats per minute, and your apical pulse sounds good. All right, so doing okay?
Doing good.
All right, so now I'm gonna lift your shirt again, and we are gonna listen to your bowel sounds. But before I do that, when's the last time you had a bowel movement?
Yesterday.
Yesterday,
Yep.
and do you go every day, every 2 days?
Yeah. Usually every day.
Every day? Okay. And what is the consistency and color like?
Soft but formed, good consistency, good color.
Okay, sounds good. So our patient has normal bowel habits, usually every day or every 3 days would be good. So first, I'm going to auscultate his bowel sounds, and I'm just going to tell you that this is going to be his right lower quadrant, which is going to have his appendix in there, and then his right upper quadrant, which is going to have the gallbladder in there, and then the left upper quadrant would be the stomach, and then the left lower quadrant would be the bladder. Okay, so I'm going to auscultate with the diaphragm, and I'll listen for clicks. Okay. I'm hearing clicks every time. Okay, so everything sounds good. Gonna inspect your abdomen. His color looks good. I don't see any masses or any types of lesions on there. So now I'm gonna palpate and let me know if you feel any tenderness. Okay, I don't see any distension, but I'm gonna feel for masses. Okay, any tenderness?
Nope.
No. Tenderness? Nope. All right. So your bowel sounds sound good and your abdomen looks great. So now I'm gonna test your range of motion. So let's see, bend your elbow. Okay, looks good. Let me look at your joints. I don't see any signs of swelling. Do you have any pain bending?
Nope.
Okay, I don't see any lesions or anything like that. Let me see this arm, bend. Okay, those joints right here. You do your hands like this and down. Do your hands like this again. Push up against. Okay, patient is strong. So raise both your arms up Good job. So you didn't have any trouble doing that?
Nope.
Can you
No
tilt your
pain.
head side to side? Good. Can you do it in a circle? Good job. Alright, can you bend this leg? Good job. And this leg. Do you have any pain or tenderness? You look for any swelling?
No.
No?
No pain.
Looks good. Okay. And do your feet back. You do that one too. And do them forward. Good job. Now push up against my hand. Okay. Very strong. Alright. So our patient strength is good. And now I'm going to get you to walk. And we're going to get your gait and your posture. Now before this, you don't use any canes.
No, I
Obviously.
don't. No.
Okay. Walk for us. Posture looks good. Gait is great. Now can you bend forward? Push your back. Oh, okay. Strong. Now sideways. Another side. Good job. Now you can come sit back down. Alright. And are you able to perform all your daily activities, cooking, cleaning,
Yeah.
going to your mailbox? You don't need any assistance with that.
Mhm.
Okay, that sounds good. So overall, you looked great, normal and healthy. If you have any problems with anything that I checked or you feel different, I would advise you to follow up with your primary care physician. And overall, you look great.
Okay, thank you.
Thank you.